1370 WOCA.
Ocala.
All right, 5 minutes after 10 o'clock. Thank you for tuning in. It's amazing how much the world has changed. I mean, the first thing that comes to mind when you say something like that is technology, transportation, and all that. But health has really changed as well. I have gone through a little thing with my leg the last couple of months, and the doctors tell me that 10 years ago they would have done something that left a huge scar, and now they're doing something that leaves a little tiny dot, and I'm in and out in like 20 minutes. And I guess I wouldn't have known, but they've told me that in the past it's been a much bigger deal. So we're going to learn more about health and medicine. And in the studio, we have Mark Shaw. Mark is the case manager for Dr. Juan Yordan. And we are going to talk about some of the things that they do, including platelet-rich plasma. And I'm going to let Mark explain what that is. Mark is a member of the Foundation for Wellness Professionals, a health consultant to implement procedures, and a patient educator, which is the real reason he's here right now, to educate us. And it says geriatric care is part of what they do. So I guess we're getting old, Robin. We're talking about geriatric care. Good morning, Mark, again, now that we're on the air.
Thanks for having me,
Thank
Larry.
you for coming in. So the first thing I want to ask you is, everything based on pain? Like everything we do, does it all start with pain? The only reason we go to the doctor is something hurts?
Well, most of the patients that we do, yes, we call that motivating factors. And your motivating factors is, similar to a dentist or anything else, is as a society we're pretty bad at doing anything preventative.
Yes, we are.
Other than
Yes.
brushing our teeth, so to speak, to go to the dentist. When your tooth hurts, you go to the dentist.
Right.
Well, when your knees hurt or your shoulders or you have a motivating factor, you go and see your doctor.
Right.
So that is what we do now. Just like you were saying, the pinprick and a small procedure versus this big massive surgeries and
is that
all
true
of
in
the
your
things
world
it
too,
take.
with what you've specialized in?
Yeah,
Dr.
yeah,
Yordan specializes in?
Absolutely. What we've seen is first and foremost, Dr. Yordan. I mean, he's a great doctor. He's passionate about helping people predominantly with their diabetes, as well as arthritis, and dealing with pain.
Okay.
In the villages, predominantly of where we are. So,
Can I interject a question right there? Okay.
Yeah.
When normally when I think of diabetes, I don't think of pain. Am I wrong about that?
well, yes, because diabetics can also have what's called peripheral neuropathy.
Oh, okay.
Which can be sometimes quite painful.
Okay.
And from the lower extremities to pain and numbness to needles, stepping on nails. I've heard burning sensations, all kinds of pain that they get from that as well.
A lot of times toward the end of an interview of this type, we will ask for a success story. And I know you had one. You in fact brought a video in on your phone, and we couldn't figure out how to get it on the air. We were going to play the audio.
Sure.
But give us a thumbnail sketch of what it shows. A patient who actually was he cured? Can you cure diabetes, type 2 diabetes?
Well, I can't say that I can cure the diabetes. So no, I can't. Absolutely not. But what has taken place, though, is because we run at our clinic with Dr. Yordan not only PRP treatment but a weight loss program, and diabetes can certainly be affected dramatically from the food that you intake and the diet that you're on, meaning it can certainly make changes and help with that considerably. So we had a patient who came in, has been seeing us. Dr. Yordan said, you need to do this program, which he did, and he did the weight loss with us. His A1C went from 11 to 6.5.
What is that, A1C?
Thank you, Robert.
That pertains to, and every diabetic will know what A1C.
Yeah, I'm sure they know.
Yeah, with the insulin, and without going into a long, drawn-out, very medical procedural explanation. It deals with the insulin in their body and everything else, and from the medication. So it went from being something that is very, very high, and those are very powerful numbers, meaning to 6.5 being an A1C. his diabetes went from out of control to it's now under control, and he lost 30 pounds, and he has a eating program with this diet that he can take with him for life,
right.
And basically a change in lifestyle for him. So it was a very, and we've got many other patients that are just like that.
What, in the eating program, is it a sugar thing? Do you avoid sugars, or is it more than that?
It's much more than that. It's a 16-week program that you see us once a week. And through supplements and dietary change, we monitor each week how your body's reacting with the program. In men, we tend to see anywhere from 30 to 35 pounds on weight loss, and in women, unfortunately, Robin, sorry, that they lose weight not as quickly, so it's 20 to 25 pounds with women during that time. But the difference between us and say, like, well, Mark, what's the difference between that and Jenny Craig or this or that? Diet programs, ours is a lifestyle change with that. And what I mean by a lifestyle change is it's sustainable for the rest of your life, meaning once you get through with this program, that's how you're going to eat and how you're going to work for the rest of your life, so that 25 and 30 pounds doesn't come back.
So is this, can insurance cover the cost of this?
Insurance doesn't cover the cost.
Okay.
And it doesn't cover the cost with PRP as well, simply because it's not covered by the Food and Drug Administration because it's not a food or a drug.
I got you.
PRP is done, with your own blood.
For the listeners, now you explained before we went on there, PRP stands for platelet-rich plasma.
That's correct.
And we're lay people, but we have a great relationship with the Life South Blood Bank. Okay. And so they've taught us, we're blood donors, so
sure.
We understand that's all we know about platelets is it's part of what we donate.
So let's do a layman's version of a kind of a breakdown of PRP so that you can understand. So when you were a young man, Larry, you remember falling off a bike or falling out of a tree or playing football, roughhousing, anything like that.
I remember the bike.
Yeah, you'd scrape your elbow or your knee. It hurt for a little bit, you'd make cry, and then you would, then you'd come back 3 minutes later and you'd be back on the bike riding the bike, and it didn't hurt near as bad. And that wound or that would heal very, very quickly, right? All right. So as a young man, that's because you have billions and billions of stem cells and cells that go into your body that go in and fix and repair things, okay? And as you get older, those decrease throughout your body because you don't need them as much. You're not
a whole lot.
Right, exactly.
Is that really why your body just knows you're not going to get into as much trouble?
You've grown as much as you're going to grow. You're not creating, so you don't have a need for them as much, okay? And that's what we utilize, but there's still stem cells and platelets and white blood cells and all those kind of things in your blood right now, right? And when we draw that out of your arm, okay, we take that and we put that into a machine that spins it down.
Okay.
So that we're taking those stem cells, white blood cells, platelets, all of those things, and we're compacting them into a very dense and tight-knit group down in that vial. And then we're going to draw that off with a needle, okay? And we're going to inject that back into the area of injury, whether it be your knee, your shoulder, or anything else, because all of those healing properties and the things that are in there, we've centrifuged it down so it's in a very tight group, back like when you were a younger man, so to speak.
I think on the phone is Dr. Juan Yordan. We haven't been able to speak to him off the air because of the timing he called. So let's say hello real quickly. Then we'll go to a break. Then when we come back, we'll have both Dr. Yordan and Mark Shaw. Doctor, is that you?
Yes.
Well,
it's me. How you doing?
Good. Thank you so much for calling in. If you can hang on, because we're right up against the break.
You have to wear your headphones to hear it.
Yeah, you'll have to wear the headphones. Sorry, Mark. First of all, thank you for doing this show, Doctor. I'm really enjoying the information that Mark has given us so far. During the break, you'll be able to talk to Mark off the air, and Mark, you'll be able to talk to the doctor, and we will be right back for the listeners. By the way, if you want to call in with a question, the number is 622-9622, and we'll give you the doctor's number as well after the break. We'll be right back.
The weather is brought to you by myfwc.com. Safe boating is no accident. On this Thursday, lots of clouds, gusty breezes, and a shower and heavy thunderstorm or two. They can bring torrential downpours, damaging wind gusts, even an isolated tornado. The high in the mid to upper 80s. Then rather cloudy and breezy Thursday night with some rain and a thunderstorm, low 74 to 78. Friday, mostly cloudy and windy with still a little rain at times and a thunderstorm, the high in the 80s. From the Florida Weather Center, I'm meteorologist Joe Lundberg.
Next Generation MD is the future of healthcare now. Listen in the first and third Thursday at 10 a.m. to learn how the future in PRP treatments are here in our area. Find out the many ways that Dr. Juan Yordan, MD, Charles Brooks, NP, and case manager Mark Shaw have brought the family medicine practice to a new level. Hear from the very people that benefit from the fine work they have done in this field. Next Generation MD every first and third Thursday at 10 a.m. here on WOCA 96.3 FM, 1370 AM, The Source.
Looking to put your money to work? Florida Credit Union has a CD special, 25 months for 1.41% APY with a $10,000 minimum. Federally insured by the NCUA, a government agency. These rates effective through September 15th, subject to change at any time. Visit one of Florida Credit Union's convenient locations today or their website, flcu.org, or call 352-237-8222. Don't miss this 25-month CD special. Again, the APY is 1.41%. Act now.
Highland Memorial Park is known for being the most beautiful and family-oriented cemetery around. They're continually building eye-catching features that make the park stand out. They also offer a wide variety of pre-planning services to bring peace of mind to your loved ones. With nearly 70% of us being cremated here in Ocala, Highland wants you to be aware of how much money can be saved. A man and wife can save thousands of dollars with cremation and still have a remarkably peaceful and dignified burial. Whether your choice would be in ground or above ground, you owe it to yourself and your family to see how much money, time, and grief you can save by taking care of this now. Call today to get the answers to your questions and see if cremation is right for you. Call 352-369-1020. That's 352-369-1020. And when you set an appointment and both husband and wife tour Highland, we'll give you a gift certificate to the Brooklyn Backyard Restaurant. Call Highland today, 352-369-1020. Don't get caught without your daily source of senior deals. Pick up your copy of the Senior Voice newspaper. It's your source for schedule and events tailored to seniors, with information you need, like a list of free events in the area. We even have Tom's Picks, a free referral for people who are looking for a company to do work for them. Tom's Picks will refer the company to you that fits your needs. And all we ask in return is that you tell them where you heard about them. For more information, call Tom's Picks, 352-804-1223. And pick up your copy of the Senior's Voice at most any business up and down the 200 corridor.
Now read Ocala Downtown newspaper online.
It's rodeo time in Ocala. The 34th annual Ocala Shrine Pro Rodeo returns to the Southeastern Livestock Pavilion September 2nd and 3rd. 7:30 nightly, cowboys ride to help children walk with all the major events of pro rodeo. Get your tickets now for broncs, bulls, and babes, cowboys, cowgirls, and you. September 2nd and 3rd, the Ocala Shrine Pro Rodeo. Don't miss it.
All right, 18 minutes after 10 o'clock. Thank you for tuning in this Thursday. We have a new program that we're doing for the first time right now. It's called Next Generation MD. Dr. Juan Yordan is on the phone, and in the studio is Mark Shaw. And we're talking about geriatric care, orthopedic care, diabetes, medical weight loss programs, the PRP program, the platelet-rich plasma program. Hope I said that right.
That's correct.
And we really didn't get a chance to say much to Dr. Yordan. Doctor, are you still there, I hope?
Yes, I'm here.
Do you know, one of the things that we've already learned in the short visit we've had with Mark is that it's amazing how you, in the medical field, have figured out a way to perhaps use our own bodies to heal ourselves rather than resorting to the scalpel or to chemicals or medicines. I mean, I'm sure all those things still come into play, but the idea that you can use platelets and plasma and all that, that's amazing to me.
Yes, I mean this is a new this is a relatively new program that has come up, and the results that we've been getting at the office are great. I mean, we started this program a couple of months ago, and patients that have previously had problems with their joints, with their knees. We have patients that have neuropathy, being from diabetes or any other source of it, that have done the program. Most of them are getting incredible results. I mean, we've had patients that have come back after a patient with neuropathy after we've done the treatments, and just to tell us, just for a follow-up visit or whatever, and to tell us, that people around him have noticed, the way he's walking, the better way he's walking, the better way that he's getting around. I mean, so the results have been very good. And again, it's something that we're doing that is not, there's no chemicals involved. It's basically your own body healing itself. Or helping heal itself.
That is amazing. And somebody, if you're listening right now and you have a question, please call in 622-9622. Can I ask about the diabetes part of this?
Absolutely. You can ask Dr. Yordan about that.
The mixed messages we're getting are that it's about diet, it's about exercise. Is the real truth it's about both?
Yes, it's actually, you could not have one without the other. I mean, especially a patient that has diabetes. We have to increase or improve his metabolism. We have to improve his sugars. And the best way of doing it, I mean, of course, there's medications for it, and we're not putting out medications. We're not discarding medications because that's something we've been doing for years. But there has to be a compromise of the patient. If the patient loses weight, if the patient starts doing exercise, improves greatly. I mean, we have a patient that has done our weight loss program, which has improved his diabetes greatly. There's a measurement that we do. It's called an A1C, which basically what it is a 3-month average of your sugars. You kind of go back 3 months and tell us, for the past 3 months, the sugars have been running good or not. And a patient that is well-controlled diabetic, normally we like them below 7, somewhere there. I mean, this patient had 12.4 at that point. He started doing our program. He started doing the weight loss clinic. He's lost over 30 pounds, and his A1C now is below 7.
This is Vincent, same person? Okay,
yes.
Yeah.
Same person. And not only that, I mean, we have been having to back off of some of his medications, including his insulin, because now, of course, with the weight loss, his sugars are much better, more controlled, and then he doesn't need as much medication as he did in the past.
The neuropathy that is associated with diabetes, does the nerve endings that are damaged because of that, and forgive me, I'm a lay person, I have no idea what I'm really asking here, but I know there's pain, I know there's nerve endings. Do they grow back to be normal, or does the foot begin to feel normal at any point?
Well, you can have some improvement on the neuropathy. The neuropathy is something that's just damage, nervous damage, not damage to a nerve because of the sugars and the condition itself. Most of the time, it's not. Most of the time, the damage that's there is there. There could be some improvement on, with the improvement of the sugars and the lifestyles and exercise and all that. Yes, we can get some improvement, but a lot of the time, the damage is there.
Okay, so you have to live with that, I guess, huh? So, but do we stop it in its tracks if you can get the diabetes under control? Does the neuropathy stop progressing? Does it stop getting worse?
The progression, yes. I mean, the progression of the neuropathy, of course, it's more when your sugars are uncontrolled. So the tighter your sugars are controlled, or the better control you have out of your sugars, the better the chances for that neuropathy not to progress.
Sometimes some people are happy with the way they look and feel, but when they come to you, and if you recommend to them that they need to have some kind of weight loss program because they are borderline diabetic, how do you convince them to do that?
Well, a lot of the times, especially when they are, let's say they're a newly diagnosed patient with diabetes, that's something that shakes the patient up. When you tell a patient your sugars are high, now you are considered a diabetic, we definitely need to do something for this. It's something that triggers, a reaction of the patient. Now, the problem with this is that, they will go and, they will do the diet, they will do your recommendations and the exercise and all that. The problem will be that feeling or that reaction usually does not last long. Sadly, it does not last. 6 months after that, they're slacking a bit on their diet, or they're slacking a bit on their exercise, their sugars go back up and start to go back up. So that's why it's so important that it's a commitment. It's a lifestyle change. We're not talking about a 3-month treatment. We're not talking about you have to change your lifestyle. You have to understand, yes, that this is the card that you were dealt. We have to deal with this. We can get it better. We can improve it. But it's up to you. Yes, like I said, there's medicines that we use, but the lifestyle change, you have to make a commitment to that.
Any of us who are old enough remember when we were kids, the people who were our age back then, and it just seems to me that if I go to the villages right now, where there's a lot of folks who actually make me feel young because they're older than me, they're actually very active. And I remember as a kid, people that age, they weren't really that active. So I mean, a lot has changed in the world, and I'm guessing this is part of it. So if you're isolated somehow and you don't know about these procedures or these opportunities, I hope you are listening and you call the doctors.
Well, let me take one chance here, Larry, just to jump in, and we make a promise to all of the patients who will come and see us at Dr. Yordan's office. I make this to every single one. Come in, have a free consultation with me.
There you go.
Sit down, have a consultation, and let's determine, what is the right procedure or the right program for you to go into. If you have any questions whatsoever in regards to that, I would say come visit us at Dr. Yordan's office. If for some reason we can't help you, okay, and Dr. Yordan and I, it's not within, the scope of what we do, we'll do the work and we'll refer you to the correct doctor who can.
And your office is in the villages?
Yeah, it's in the Rolling Oaks Professional Plaza, and that's 929 North U.S. Highway 441/27. We're Suite 102. And, of course, the telephone number that you can contact us is 352-633-0473. So they can contact us, and certainly we will schedule them in, of course, when we have an opening. But it doesn't cost you a dime to come and sit down and have a consult and a consultation with me to go over, maybe it's a bad knee, a shoulder, or I've got diabetes. I need to lose 30 pounds, and I'm concerned about this or that. By all means, come see us. We will definitely help you.
Is there something you can say to the listeners who don't think they have diabetes, just to, not to scare them, but to make them aware that they might be a candidate? Is there something they might be noticing about their, about the way they breathe, the way they walk, the way they feel?
I'll let Dr. Yordan answer that.
Yeah, I mean, there's little signs that we can see when our sugars start to go up. I mean, sadly, there's not a big change that you say, okay, I'm diabetic or I'm getting there. But there's little signs or symptoms that definitely you can watch for. For example, people when their sugars start going up start having increased thirst. If your sugars are up, you're getting more thirsty than normal. You're going to the bathroom to urinate more than you did in the past, or even you getting hungrier. Those are the three main symptoms when your sugars are going up. I'm noticing that I'm always hungry now, and I'm going to the bathroom to urinate a lot. I'm waking up 2, 3, 4 times at night, and something that was not happening before. Which again, it could be other symptoms of other things, but those are symptoms that your sugars might be up, and it's something that needs to be checked. Things like wounds that are not healing properly or taking too long to heal. All those things are things to watch for, and to consult your doctor or to talk to your doctor if you notice anything like that. And again, we don't pretend that we can fix everything, or because that's not correct, but if we can definitely help, we do. I mean, I've been practicing medicine for 20 years, and and the mainstay of my practice is medications, and let's get this done. But if we can help, if we can get it better by other means, not only medicine, but let's drop the weight, let's get more active, let's the PRP program is excellent. It's something to another thing to consider.
Okay, Doctor, we're out of time, but thank you so much. I hope we get to meet you in the studio. For everybody else, you can visit Dr. Yordan and Mark Shaw down in the Villages. I wrote down 999 North Highway 441, Suite 102.
929.
929. I'm sorry.
Yep.
Okay, 929. And the phone number again?
Is 352-633-0473. And that's in the Rolling Oaks Professional Plaza.
Okay, thank you, Mark. And thank you, Doctor.
Thank you. You have a great day.
Thank you. We will be right back.
The morning after voters got a glimpse of what a President Trump would do on immigration.
We will begin working on an impenetrable, physical, tall, powerful, beautiful southern border wall. There will be no amnesty.
In Phoenix last night, hours